I think it's good, especially to Dr. Review.
All right, hello everyone. We're about to get started. My name is Geneva Malone with the Levy Senior Center Foundation. We are happy to welcome both our in-person and remote audiences to today's Levy Longevity, Integrative Approaches to Brain Health with Dr. Geeta Maker-Clark. Dr. Geeta is the Director of Integrative Nutrition at Endeavor Health. She believes that any meaningful healing must involve the mind, body, and spirit, and that whenever possible, the most natural and least invasive intervention serves the highest good of the person. Dr. Geeta is a graduate of the University of Arizona Fellowship in Integrative Medicine. She is a certified prenatal yoga instructor, a practicing yogini for the last 20 years, and a devoted student of life. She is the co-director of one of the first culinary medicine programs in the country at the University of Chicago and Pritzker School of Medicine. She speaks around the country on the power of food as medicine and started the first Midwestern CME symposium solely dedicated to emerging nutritional science, and runs a Food is Power program with her medical students and chef in Englewood, Chicago for middle schoolers. Dr. Geeta sees patients in her offices in the Chicago area and also by telehealth, and her work is deeply informed by her passionate involvement in the community she serves. We are thrilled to have Dr. Geeta with us here today. This program is made possible by the Levy Senior Center Foundation and the City of Evanston. As always, we appreciate your support of the foundation as we continue to work to connect our community of older adults. As a reminder, please silence all your cell phones and reserve all your questions until the end of the presentation. At that time, if you have a question, we ask that you raise your hand and wait to be called on. Please keep in mind that Dr. Geeta will not be answering personal medical questions. And all right, I'd like to now turn things over to Dr. Geeta Maker-Clark.
It's really nice to be back again. There's some familiar faces here from last week and some folks coming in. So just absolutely come in and find a seat. So today we're going to be talking about brain health. And this is a topic that, I think affects every one of us of all ages, right? There's so much that we need to learn and know about our own brains. And quite honestly, there's so little that we actually understand about the human brain still in medicine and in science, in neuroscience. So it's a pretty fascinating topic to me. And it's one that I try to learn as much as I can about. I'm hoping today we can share some general ideas on how we can approach brain health from an integrative perspective, and hopefully give you some time to also answer some questions. So, this is a question that I don't think many people wonder about. Why does brain health matter? Well, because if your brain's not healthy, it doesn't really matter what other part of your body is healthy, right? You need a healthy brain to live a healthy life. And 1 in 3 adults actually face a brain-related health challenge, and that includes younger folks too. I see lots of kids with concussions, multiple concussions, who've had falls, kids with depression, anxiety, and all through, all the way from the little ones to our elders in the practice, who have a variety of issues that relate to the brain. Chronic stress and poor diet and sleep deprivation accelerate decline. Okay, and that's what I'm really going to be focusing on during this talk today, are the things that we can do to prevent decline. Because one of the great difficulties in working with brain health is that once things start to become, start declining, they're very hard to stop. And we're doing everything we can in modern medicine and neuroscience to create pharmaceuticals that can help cure dementia, or that can help cure, the mental health ailments that many people have. However, our greatest, source of strength really comes from prevention. And there's a lot that you can do to prevent and uplift your brain health through lifestyle changes. And integrative medicine offers those opportunities to prevent and repair by looking at the entire picture rather than just like one narrow sliver of what's going on in the brain. right? So for those of you who aren't familiar with integrative medicine, this whole longevity series is presented by members of our integrative medicine team at Endeavor Health. And we are family doctors, internal medicine doctors, and also nutritionists who have been trained in something called integrative medicine. And what that really is, I mean, I really think it should be all of medicine, but what that really is looking at the whole person and all of the systems of the body and how they interact, looking at mind, body, spirit, emotional health, as well as physical health. Right. So an integrative perspective really dives deep into your lifestyle, the way you live, all of the things that factor into your health. And it seeks balance, really, not just disease management. So it's not just about going and getting that one part taken care of that's bothering you. We're really looking at the entire system of your whole life and lifestyle and how we can find balance to support all of the various issues that you may be having. So the brain is so fascinating because it's truly an ecosystem, like the gut in many ways. It's an ecosystem onto itself. And the neurons, which are this nerve cells, the cells that the nervous system is comprised of, are also tied in with the gut microbiome. They're also tied into all of the hormones that our bodies are secreting. And they're interacting and changing and moving all the time. So there's this term called neuroplasticity. Has anyone heard that term, neuroplasticity? A lot of you have. Neuroplasticity is a really important aspect of human health that we're only now starting to understand. And neuroplasticity refers to the ability of your brain to continue to grow and make new connections. So this idea of like you can't teach an old dog new tricks is actually not true. What we're finding is that you can indeed learn new tricks and you can wake up neurons that have been sleeping for a long time. Maybe you knew how to speak Spanish when you were in high school and you haven't spoken in 40 years and now you want to pick Spanish back up. Well, it might be a slow and rusty and rocky start, but your brain will start to make those connections again if you use them. And I'm sure many of you are familiar with that sort of recommendation around cognitive health. Keep using your brain, right? Keep talking to people, do the crossword puzzles, learn another language, stay connected. All of that has to do with neuroplasticity and keeping those nerve cells, those neurons talking to each other instead of staying in their same old ruts. And actually routines, even though routines are great, can keep our brain in a pattern where they don't actually grow. So that's why doing something new, I just walked past the ceramics class and I saw all these, great artists in there working on various things in clay. Doing things like that and dancing and music, listening to music, playing an instrument are so vital because your brain, no matter how old you are, is still able to make those new connections. And when you have a healthy brain, that can lead to a longer and healthier life. Are you familiar with the blue zones? We talked about this a little bit last week too, the blue zones. So the blue zones refer to areas of the world where there are very high rates of centenarians, people who are 100 years old or more, who are living healthy lives, not just being 100, but being 100 and healthy and vital. And a lot of what we're seeing in those areas is a combination of diet, geography, community connection, and this neuroplasticity, this constantly being stimulated, learning new things, being exposed to younger people, different kinds of people, and keeping the brain really healthy. And so that, in my opinion, health is really about being resilient and being flexible, right? Not being stuck in like one particular way. And if we can stay adaptable and flexible, our brains can continue to stay healthy well into our the last chapters of our life. So nutrition, which is of course one of my favorite topics, plays a very large role in neuroplasticity. And I will go into some detail about this a little later on. But some of the research that we have around what in particular that one should eat to help for neuroplasticity and brain health focuses on omega-3s. Omega-3s are found in fish, fatty fish. They're very abundant in the Mediterranean diet, which has a lot of olive oil and fatty fish in it. But omega-3s are also found in avocados and walnuts, chia seeds, flax seeds, hemp seeds, fatty fish I mentioned, olive oil. So there's a lot of ways in which we can bring omega-3s into the diet. Polyphenols come from fruits and vegetables. Those are antioxidants, and those also enhance the connectivity of the neurons. So polyphenols are found in great abundance in berries, for instance. So eating berries, all kinds of berries, all colors of berries, is a great way to bring polyphenols into the body. And of course, these two things, omega-3s and polyphenols, are great for everything: cardiovascular health, musculoskeletal health, kidney health. I mean, they're just great for general health, but we do have a lot of research around them, around neuroplasticity. There is evidence around something called the MIND diet and the Mediterranean diet, reducing the risk of cognitive decline. So remember, we're interested in reducing risk and prevention as much as possible. And these types of diets can help reduce that cognitive decline in the research. And antioxidants like polyphenols, they fight what's called oxidative stress. It's not so important you know what oxidative stress is, but to know that it's a type of chemical reaction that actually damages cells. And so antioxidants are actually scavenging up the damaged cells. And that's why they matter so much, why eating fruits and vegetables matter so much. That's where the antioxidants live. They don't live in animals. They don't live in dairy. They live in fruits and vegetables. So the MIND diet that I mentioned was a diet that combined elements of the Mediterranean diet and the DASH diet. And DASH was a diet that was developed around bringing blood pressure down, dietary approaches to stop hypertension, DASH. And this MIND diet was emphasizing greens, berries, nuts, olive oil, whole grains, and fish for those very reasons. Lots of omega-3s, lots of polyphenols. And it limited things like red meat and butter and sweets and fried foods, fast foods, things that don't contain those nutrient density, that kind of nutrient density. And what they saw with the MIND diet was a slower cognitive decline and up to a 53% lower Alzheimer's risk. That is a very, very impressive number to get from a dietary pattern, not a drug, right? So very impressive numbers. And again, encouraging mindful plant-forward eating that's supporting vascular health and neuronal health. When I say vascular health, we're not just talking about the neurons staying healthy, but the brain is filled with blood vessels like every other part of the body. And things like stroke and dementia have a lot to do with how those blood vessels are interacting in the brain, how healthy those blood vessels are. So this type of a diet also supports that vascular health and keeps the blood flowing well through the brain and the rest of the body, and decreases some of the greatest risks that we have for dementia, stroke, and other ailments that affect the brain. So fewer people know about the gut-brain axis. So I wanted to spend a few minutes talking about that. Has anyone heard about the gut-brain connection before? Some of you? So this is fascinating, and again speaks to the fact that we have a very sophisticated, interconnected body, right? There's nothing that's working out here all by itself and this thing all by itself, even though the amount of specialists you might have in your care team might feel that way. You've got your ear, nose, and throat doctor, and you have your sports medicine doctor, and you have your back doctor and your brain doctor. And it starts to make you feel like, oh, well, I just have all these different parts and they're not connected to each other. And neither are these doctors, right? But every part of the body is communicating with every other part. And the gut and brain have a very tight connection. And this is not rocket science, right? When we get nervous, what do a lot of us feel first when you get nervous? Yeah, you start feeling like butterflies in your stomach, right? Like the gut is where we manifest so many of our emotions. If you're stressed out, oftentimes either you feel like eating a lot or you don't feel like eating anything, right? It has some effect on your appetite depending on what your constitution is. So something that's fascinating to me, you may have heard of the neurotransmitter serotonin. It's the one that gets a lot of attention because many of our drugs for depression and anxiety focus on increasing serotonin. 90% of serotonin is made in the gut, not the brain. It's made in the gut. So if your digestion's really off, if your microbiome has been altered by pharmaceuticals, multiple antibiotics over the years, the things that life may have thrown your way, and that has changed the diversity of bacteria in the microbiome, you may not be producing as much serotonin in your gut as your brain and your mental health require. So one of the things I always look at when patients come into me and say, I'm feeling low, I'm more irritable, my mood has shifted, is to not just look at what are those stressors that may be causing that, but to say, well, what's going on also with your digestion? Because if there's something going on there that we can fix, oftentimes that can really help with serotonin production and help with that sensibility of feeling low. So that's one piece that's really vital to know. And I think very few people realize that connection. But another important piece in the gut-brain axis is that the vagus nerve, and that's the nerve that's responsible for our rest and digest and relax response, not the fight, flight, freeze response that the sympathetic nervous system does for us. We have this other nervous system called the parasympathetic nervous system, and the vagus nerve is the one that controls that. That nerve links digestion and emotion. So that's the one that's kind of responsible for whether you're having the butterflies in your stomach or you're having maybe loose bowel movements because you're feeling really anxious or stressed out. That's all being modulated through the nervous system. So we tend to think, oh, well, my stomach's upset. This has to do with my stomach. And it may be that your digestion is off because of what's going on up here and vice versa, right? So it's an axis, it's communicating. And there's actually a field of study called gut-directed hypnotherapy. There are folks who have PhDs in this. We have some of them trained here at Endeavor who help folks who have chronic issues with their gut that haven't been resolved by various interventions to learn how to control through hypnotherapy, through their own minds, how their gut is reacting. It's pretty cool, isn't it? That you can go see somebody who can teach you that, something that we might not think we have control over, but we actually do have the capacity to control with guidance. Sleep deprivation becomes a really big problem. So deep sleep's really important. And there's a lot of reasons why people don't sleep well. We're not going to dive into that today, but those are things to talk about with your physicians, with your healthcare professionals. Like, I'm not getting a good night's sleep. What can I do about that? And that'll be so much more bang for your buck than like, let me buy a $60 supplement that somebody sold me that promises better memory. Okay. Melatonin, we're familiar with that around sleep. It's a hormone that regulates our circadian rhythms, our sleep-wake cycles, our light-dark sensitivity. We are animals like every other animal on this planet. We're kind of meant to be roaming around doing our things in the daytime and then resting at night, unless you're nocturnal, which we are not. We act like we're nocturnal because we have electricity. So we just keep the light going on and on and on. And then we have this thing, and that keeps the light going on and on and on, even into the middle of the night. So our melatonin gets all messed up because melatonin needs darkness to go up. It will not rise on its own without darkness. And that darkness needs to come in through your eyeballs. You have to witness darkness. So that's a really important piece of taking good care of your brain, is making sure that when it's dusk and that light starts to go down, that you're witnessing that dusk, that your brain is allowed to see that it's time for the melatonin to start going up, because then it'll be at the level it needs to be at night when you need to actually go to sleep, and you need to stay away from this thing as much as possible when you get within a few hours of when you want to go to bed, because even 10 minutes of looking at your phone or your laptop will decrease your melatonin levels so precipitously, it will take 2 hours for them to go back to where they were. 10 minutes on a phone sets you back 2 hours in sleep because it's really bright light. Even if you have a dimmer on this or this, even if you have a dimmer, it's really bright light. Okay. So sleep is very important brain medicine. Mindfulness and the brain. we have lots of study, and a lot of this came from the work that the Dalai Lama brought forth to the United States around meditation and brain health. We know that meditating reduces the activity of the part of the brain that keeps us anxious, the amygdala. The amygdala says, danger, saves our life, right? There's a car about to hit us and we see it and we like, the amygdala kicks in and it sends all the blood to all the places that need the blood so you can tear across the street quickly and avoid getting hit. It saves us. It also, in this modern life, is firing all the time, unnecessarily. We're living in this flight and fight and freeze situation from all this chronic stress, and the amygdala gets very ramped up. And that's where anxiety comes in. When people feel anxious all the time, it's because the amygdala is overactive. And meditation reduces that reactivity. And that's something we have control over, that we can do for ourselves, is learn how to meditate. It's not that hard, and it doesn't mean sitting down and sitting in some difficult posture or being totally silent or having your eyes closed. Meditating can be when you go for a quiet walk. Meditating can be dancing. That's what it is for me. Meditating can be movement. It can also be sitting down, if that's what you like to do. It can be lying down. Meditation is a vital part of keeping our brains healthy. And it strengthens our attention network. It cultivates calm. It cultivates focus over time. And it can even be just a minute or two a day. It does not have to be long periods of time to get these kind of effects. Okay. Social connection. Loneliness is a toxin to the brain. Loneliness is a disease, we're realizing, actually. It can affect us in ways that are just as profound as if we were smoking a pack of cigarettes a day. So relationships are really important, and why places like the Levy Center are important. Because even if you feel disconnected in maybe your family relationships or friends who are no longer with you or you're not close to anymore, even putting yourself in situations where you're around other people really helps to create a sense of belonging. And that reduces your stress hormones, and it actually stimulates the brain to feel like it's getting some kind of a reward. Because that's what our brains want. Humans are herd animals. We're not lone wolves. We're not solo animals. We are herd animals. We're meant to be around each other. And somehow things got really skewed in the last, 50, 60, 100 years, where people's lives got a lot smaller and more individualistic, and the nuclear family got really small, and you stopped living with all your distant relatives and they became distant relatives. And, it sort of became like, oh, the individual is what matters most. Well, our bodies don't like that. Our brains really don't like that. It likes community. We like community and feeling belonging. And so that's very important, is to make sure that we stay socially connected, to make sure that we stay creative. We spoke a bit about how dance and music can be a part of that, and art as well. So being creative in any ways that you like to be creative. It doesn't have to be anything different than what you already know. If you like to draw, if you like to paint, if you like to play something, if you like to clap, you don't even have an instrument, you like to listen to music and clap or sing along with it. All of these things help build cognitive reserve, and they stimulate dopamine and pattern recognition in the brain, the right and the left side communicating again. And that is what we want. We want to cross-train the brain, just like we cross-train the body, by doing lots of different creative things, talking to other people, staying in interactive spaces. And of course, there's nature, right? We get sometimes really indoorsy around here, especially now that this, seasonal shift is starting to happen. It's time to get pretty indoorsy. And time outside is really vital, however you can do that. For me, I live kind of by the lake, and because there's no real forest preserves around here, I feel like the lake is my wilderness. Like that's the place where I can look at something really far out, not see anybody else, and feel like I'm in a wild space. And I can really feel how it changes my nervous system. But you don't need to go for a walk on the lake or go to a forest preserve to enjoy nature. You guys, there's a beautiful garden in here in this courtyard. It's just gorgeous. And that kind of space, just being in those kinds of spaces, maybe your garden's at home, or maybe just in one of the community gardens that we have around here, will boost that rest and digest and relax part of our nervous system, that parasympathetic nervous system. And recognizing beauty is something that our brains also really like and recognize, right? See beautiful flowers or a beautiful tree and you stop and just take it in. And that awe and that beauty is really important for our brains because it reminds our brains of our old primal nature. And a lot of what I'm saying is to remind and remember that this isn't a new piece of machinery in our head. This is the same brain your great grandma had, and it's the same brain that your cave people ancestors had. Really, we always have wanted the same things: light and dark, nature, connection, sleep. It's a lot of the same primal medicines that keep our brains healthy. And we don't need to be focusing on really, complicated interventions. We oftentimes just need to focus on what our own brains and spirits really need. Now, of course, when we have issues with our brain, there's so many different types of chronic diseases that do affect the brain. Inflammation, of course, is what ends up being the driver of this cognitive decline. So last week, we talked about anti-inflammatory diet a fair amount. We talked about sleep and movement today and the mind-body balance. All of these things are anti-inflammatory. They're all driving down inflammation. And the less inflammation you have, the less chronic disease you'll have, and certainly the less cognitive decline. So when it comes to integrative clinical approaches, when people are coming to see me in the office, to see the team in the office, and they want to know, what else they can do besides hopefully a lot of the things we've been talking about, there are several things that we might add in. And nutraceuticals is a way of saying there are nutrient-based supplements that exist that are food-derived, that oftentimes have doses that are higher than what food can provide, that we sometimes lean on. Some of the ones that are particularly well studied for brain health are curcumin, which is the ingredient that is the active part of the spice turmeric that you may be familiar with, turmeric. Omega-3s we already talked about, and magnesium, which many of us are deficient in because the soil has become rather deficient in magnesium over time. It used to be a lot more in the foods that we were eating. So those are some nutraceuticals. I'll talk about them in a minute. Acupuncture and yoga are mind-body therapies that are very, very helpful for stress modulation. However, that stress is interpreted by your body. It may be interpersonal stress. It may be stress from pain. It might be stress from a chronic disease or more that you have. Acupuncture can help quite a bit with that. That is traditional Chinese medicine. And there are many other modalities like acupuncture and yoga, like Tai Chi, which I think is offered here at the Levy Center, and I'd highly recommend. Tai Chi is another form of traditional Chinese medicine that is great for balance, it's great for strength, and great for brain health, and has been studied very widely for dementia risk and balance and falls, in particular, fall prevention. And then, of course, cognitive behavioral therapy, which is like actually getting a therapist and working with a therapist, and mindfulness therapies, which can be like mindfulness meditation that we were just chatting about. All of these things are ways of combining mind, body, spirit interventions to have optimal brain health. So mental exercises are wonderful in addition to physical exercises. And I think a lot of you are pretty aware of puzzles, correct? And Sudoku and reading and even listening to audiobooks if your eyes aren't wanting to focus so much on reading anymore. That mental and physical combination is really important. And we talked about a lot of the rest of these things. So to summarize what I've spoken about so far, when we're supporting our cognitive function, which let's be honest, that's what we really care about when it comes to our brain, right? It's like how sharp we are, how sharp the brain is. That's how we feel our brain is doing well, when we have good focus and concentration and memory and clarity, that your brain is always growing. There is a lifelong neuroplasticity, bless you. The brain can adapt and grow at any age. Okay, there isn't like a stopping point there. That being physically and mentally engaged will boost your memory and your focus, and then combining approaches is the best way to protect your long-term brain health. Okay, I'm going to go into a few supplements because I know people want to know about this. And there's actually only a few that have been studied well enough that I feel like I could recommend them in a general space like this. There are others that I use. I use them on a case-by-case basis, depending on what your other medications are, your other medical issues are, and so forth. So that's a more individualized approach. From a general approach, we talked about omega-3s that come from food. Sometimes folks want to just take a supplement as well because they may not be eating all of those foods in good quantities. So you can actually buy omega-3 fish oils if you're someone who does eat fish. And what omega-3s actually do in the body is they support the signaling of the neurons to each other, and they support the cell membrane. So every cell in your body has a membrane that has a fatty wall around it, and the omega-3s build that wall. So it's vital that we have strong cell membranes, and that piece can only come from omega-3 that we consume, because we don't make it. Our bodies don't make it. We have to eat it. So we do see in some of the studies that there's improved memory and some reduced brain shrinkage, which can happen as we get older with omega-3s, and probably why those blue zones, many of them are around areas where people eat fish. You know, they're around open water. From a dosing perspective, most omega-3s are sold in 1,000 milligram capsules, and somewhere between 1,000 and 2,000 is appropriate for most people. I usually don't go much above that. First of all, they're pretty big, as you can see, and they're not that easy to swallow, though you can get smaller ones, but they can cause blood thinning in higher quantities. So I don't go above these lower quantities, especially in folks who are older and might be more prone to have thinner blood. B vitamins, also lots of research around the B vitamins and what color food are the B vitamins found in, right? Yeah, they're in the green foods. You can't go wrong with the green foods, any of them, especially the leafy greens, this is their season right now. This is our shoulder season where we're getting the best leafy greens, the best shards and kales, and some spinach is still lingering around. Green beans are still happening. So these B vitamins, the B6, B12, folate, these all support the production of neurotransmitters. Every neurotransmitter in the body requires B vitamins to get made. It's an important building block. If you don't eat enough of them, your neurotransmitters can't be produced at the level that you might need them, right? And deficiencies become very common as we get older because we aren't always absorbing as well as we were in younger years. So you may even be eating really good amounts of green foods, but not absorbing them that well, depending on your particular gut function. Okay, so sometimes I'll supplement with B vitamins, and usually at the kind of standard doses that you will see a supplement has in one tablet. So, people will ask me, well, how much of the, I have a lot of patients who take a lot more than what's recommended on the bottle. Honestly, what's happening is you're peeing out the rest. And it's kind of a waste. And when I check blood B12 levels, they're like out the roof, because I can always tell when someone's supplementing too much because those levels get really high. They're not always dangerous, but it's just better to stay in the standard doses that the bottles provide. I don't think every company out there is making a great B vitamin or a great omega-3. So this is another place to speak with your physician about what they particularly recommend. These are not FDA regulated. So sometimes the bottle says something different than what's inside the bottle, right? So there are some better brands than other brands. And then curcumin, we talked about as being part of turmeric, the active ingredient in turmeric. You probably know turmeric from the spice bottle. You know, it's this beautiful golden brown spice, but I don't know if you have seen the raw root form of turmeric. It looks a lot like ginger, but it's orange on the inside. And it peels just like ginger. It chops just like ginger. It's a root. It's the root of the turmeric plant. So curcumin actually crosses what's called the blood-brain barrier and boosts up that neurotrophic factor I was telling you about, that hormone that the brain needs to grow and thrive. So curcumin has been shown to do that. And that's why, actually, interestingly, the reason we know so much about turmeric and why it's become so popular is when we were noticing dementia risks, dementia numbers and rates were going up very high worldwide and specifically in America. A lot of the studies started to turn towards where in the world there wasn't very much dementia and trying to understand why. And in India, there are very low rates of dementia. And some of the reason of that was thought to be the amount of turmeric consumption that happens in India. And that sort of put turmeric in the spotlight. And then we found that it has lots of other anti-inflammatory potential as well. So curcumin is a wonderful compound, and turmeric is a wonderful spice to bring into your life. It's very important, as you see in the bottom, that it is absorbed with black pepper or with fat. So putting turmeric dry on something not only tastes really bad, you're not going to absorb it. It needs to be sauteed into a warm oil, preferably with black pepper. And then you saute your onions and garlic and whatever else that you're going to be making. And then you'll get the best absorption. And that's how we prepare it in India. Green tea, bit simpler than turmeric in a lot of ways, because you can get green tea bags fairly easily, and that's something people can bring into their lives very cheaply and easily. And that also has some very important compounds that protect neurons. Green tea has caffeine in it, so be aware of that. It's not your nighttime herbal tea drink. It's maybe more of a morning thing or early afternoon. Some of the emerging research that I'm not going into, but you should be aware of, because there is a lot of research going on in brain health right now, is the use of psychedelics to assist with therapy for people who've had trauma. Trauma is different for different people, how we experience trauma, what we consider to be trauma. And so getting therapy for that is very, very important for your brain health. You can be exercising and eating well and well connected with friends and dancing. And if you'd experienced significant trauma in your life and haven't really dealt with it, it can still lead to a sense of brain fog and poor memory and poor brain health, because it's a lot of overwhelm for the nervous system when we've experienced this. Okay. So, and at any age, I tell people, like, it's never too late to get therapy for your trauma, because it can be very, very helpful. We're seeing more personalized nutrition by mapping people's individual microbiomes, which is really interesting. And then there's sort of this AI-based neurofeedback that's happening. So, you know, in this next 20 years, I think things are going to change a lot for brain health. But the basics are always going to remain the same, right? We can never skimp on the things that we've just discussed. Those are always going to remain the same. A few things that I thought you might be wondering about, because I get these questions very often. Question of, is dementia hereditary? It's kind of a terrifying question, right? If you have someone in your family who's suffered from dementia, is to wonder if you might be next. And I think it's very important to know that most dementia cases are not directly inherited. There are some rare forms, like early onset Alzheimer's, that are strongly genetic. There is a particular gene called ApoE gene that increases risk, but just because you have that gene doesn't guarantee the disease. So sometimes it can be very anxiety provoking to get a test like that, find out that you're positive, and then wonder if you're going to develop dementia later in your life. So it's a very personal decision to make, to decide whether you're going to get genetic testing. And then the pieces that I've talked about, nutrition, movement, stress, social engagement, they can reduce risk even if you have a genetic predisposition, right? Genes get turned on and off by the way we live our lives. So even if you have come from a family of diabetics, You may not be diabetic based on the way you live your life. It's the same thing for dementia. Another question I get a lot is what causes memory loss, right? And there are some reversible causes, most of which I've covered: stress and sleep loss. I have a lot of folks who tell me that once they start getting better sleep, their memory feels sharper, right? They didn't maybe make that connection. A lot of college students who are very sleep deprived, who are doing poorly on their exams because they can't get the recall quick enough to answer the questions on the test. And a lot of times we have to have a big discussion about sleep. And that this isn't something it's not because they have ADD, which is where I think a lot of young people tend to go to, is they think they have something wrong with them. And that's why they're not doing well. And oftentimes they're just stressed and not sleeping enough. B12 deficiency, which is common, especially if you're a vegetarian and you aren't eating a lot of leafy greens, you may have a B12 deficiency. And so that's a reversible cause. We can replace B12 through food, through supplements, and that can help. Thyroid issues, certain medications can make our brains feel a little more foggy. So those are conversations to have. And then there are progressive causes like Alzheimer's and vascular dementia and other types of disorders of the brain that are more organic. But preventing memory loss, again, is always the key. And we know that the MIND diet, Mediterranean style diet, and by Mediterranean, I mean your cultural cuisine that incorporates omega-3s. Not everybody needs to eat like the Mediterraneans, but the way you eat, incorporating some of these important aspects of fresh fruits, vegetables, omega-3s from the MIND and Mediterranean diet. And these other pieces we've discussed, okay? So these are some of our takeaways. If you just remember one slide that kind of breaks it all down. And, I think a vision for the future is that we have more integrative clinics in every community. These are the things that I dream about, that the medicines that we prescribe first are food and movement and mindfulness, and that brain health is taken very seriously in our culture and also in our healthcare policies. So that's what I've got for you today. I hope that we can remember that healing our brain means remembering our wholeness, the wholeness of our whole mind, body, spirit, our emotions, the way we live our life, the quality of our life. And that's how we can really achieve our highest brain health. And I have a little bit of time for questions. Start right there.
I wonder what is the interaction between the melatonin we intake and the one that our body supposed to
Makes.
produce.
So the question is, what's the difference between the melatonin that you can take in a pill?
The interaction, you mean if the one you intake can avoid the production that natural should be.
Yes, and can taking melatonin change the natural production of melatonin in our bodies? It's a really great question. So interestingly, the capsules that you find in most stores are usually somewhere between like 8 and 10 milligrams of melatonin. And melatonin does much more in the body than just sleep. That's one, what I talked about today, but it's a very powerful hormone that controls many other aspects of our health. 10 milligrams is a very high dose to be using for sleep. If our goal is to get some enhancement for sleep and we're feeling like our own melatonin levels are not supporting that, I recommend around 1 milligram, 2 at the most. And when we go into 10 milligrams, we're not supporting sleep anymore. We're supporting some of the other functions of melatonin, but you're not going to get the same benefits as the physiologic level, which is more like 1 to 2 milligrams, sometimes even less, 0.5. Very low amounts is what our brain is actually creating to help us sleep. Now, if you take melatonin repeatedly over time, you can become dependent on it, and it can make it so your brain isn't making as much of it because it doesn't need to. It's sort of saying, oh, there's plenty of melatonin floating around out here. I'm not going to make it as much. So I always recommend people to use it as needed in the low physiologic doses that we're meant to take it at, and not at those big 10 milligram doses that you find at the drugstore. Yes.
It's kind of related to that. How effective is turmeric and probiotics in pill form rather than
And consuming. The question is, how effective is turmeric and probiotics in the pill form versus through the diet? Anything that you can get through the diet is preferable. It's more bioavailable. The body likes to receive it that way, assuming your digestion is strong and intact. I have patients who have a lot going on with their digestion. Maybe they have inflammatory bowel disease, or they're in cancer therapy, or a whole variety of reasons where they may not be absorbing their food as well. In which case we might depend more heavily on the supplement. The other piece I will say about that is the levels of turmeric that I would use in a supplement are much higher than what you would eat in a typical day. Even if you ate turmeric in every meal of the day, you wouldn't get to the levels that like a capsule would have because they're hyper concentrated. So that is a piece that's important to know. Like sometimes it is important to eat it, and sometimes you might need something on top of it. Probiotics, the same. I would love for people to eat more fermented foods. We're not eating enough of those. That's a much better way to support the gut's natural microbiome. And then a probiotic might be used on top of that if needed. Yes.
Are there other nuts besides walnuts with the same benefits of omegas?
Oh, yeah.
Walnuts are very popular, but what about ones that I prefer?
I know, that's a great question. Are walnuts the only nuts with omega-3s? Sadly, yes, they are. The other nuts are great. They have lots of other wonderful compounds, but omega-3s, as far as nuts go, are compounded, like you're going to find much more of them in walnuts than in any other nut. But there's also chia seeds and flax seeds and hemp seeds that have omega-3s if you like those. So those are other plant-based ways of getting them. Yes.
You had mentioned circadian rhythms.
Yes.
So, example, I have a 95-year-old cousin who is now blind. And I've noticed that her sleep-wake cycles are all mixed up. So she's awake like at 2 and 3 in the morning. But, so how does somebody who's blind, because now you're not using your eyes to figure out when you're supposed to be asleep and when you're not. How does that work for somebody who is blind?
Yeah, that's a great question. So the question is about a family member who's blind and is awakening in the middle of the night and doesn't have obviously the sleep-wake cycle awareness. I'll be honest, not my area of expertise. I would imagine that we could help by using melatonin supplementation for this person to kind of help create a cycle that they may not be able to create from their own, impairment. Yeah, thank you. Yes, you had a question up here.
Oh, that was about the melatonin. If you're taking the supplement, is there an optimal time to take that?
Is there an optimal time to take a melatonin supplement? If you're taking it with the purpose of helping you sleep, then yes, about 30 minutes to an hour prior to the time you'd like to go to sleep. Yeah. Yes.
A person that sleeps really deeply for 7 to 9 hours, but is interrupted every couple hours, 2 or 3 hours to
B.
and they can go back to sleep again and sleep deeply. Is that an interruption? I mean, if the person gets anywhere between 5 and 9 hours of deep sleep, even though there's an interruption in between, can that cause a cognitive problem?
That's a great question. So, I mean, and so many people get up in the middle of the night to go to the bathroom. The question is like, if your deep sleep is interrupted by going to the bathroom, does that affect your cognition at all? If you're still getting deep sleep, you're able to go back to sleep after you come back to bed, and you're still getting those hours. The hours that you mentioned are great, somewhere between 5 or 9 hours. Then no, we aren't seeing that is going to impair cognition, because the deep sleep, even if it's interrupted, as long as you go back into that phase at some point in the night, you're still going to get the benefits of that. And it is like, again, I always think about, you know, this is a natural part of human life too, is that we get up to go to the bathroom usually, especially as we're getting older. And so I think the brain is like well adapted to that. Sometimes what happens with patients, I hear this a lot from all ages, is that like people can't go back to sleep because their brain starts up, right? Like the list starts up for the next day, or all the things start swimming around. And that's where things like meditation come into play, and staying off of the phone before you go to bed, because all that stimulation is going to be right there waiting for you when you wake up in the middle of the night. But if you've had some time to power down, to truly let your brain like move into this next stage of rest, you're much less likely to have the racing brain start up the minute you go to the bathroom. Yes.
So is TV, or
Oh, that's a great question. Is watching TV or an e-reader the same as using the phone? Well, you know, I've never used the Kindle before, but I know that folks who do say there's like a certain dimming on it that keeps it at the same dimness level as if you were reading the book with regular light. And so I think that's been fine. I haven't looked at the studies on that. TV, however, you are still going to get blue light from the TV screen. Whether it's as bad as a phone, probably not, because this is just closer, you know, and we're watching the TV from much further away. But you can use blue blocker glasses to watch TV if that's something that you enjoy doing before bed. And be mindful of what you're watching, of course, because that's the key, is the content, right, of what we're watching before we go to bed. Yes. Ghee and turmeric. So ghee is clarified butter. Ghee is something we use very often in India as one of our main fats. And it's a really wonderful way to emulsify the turmeric. So oil is actually not used nearly as much in India as ghee is used, but it's all about quantity, right? We don't want to be using large quantities of ghee. It's a lot of saturated fat. Just a teaspoon, that's beautiful. Absolutely. Yeah, I mean, I'll say just in regular Indian cooking, we don't use a whole lot more than that for like a family size portion. If you're doing like bigger bulk cooking, you would, but yeah, teaspoon's just about right. Yes.
Can we or women oversleep?
Can you oversleep? That's such a good question. Yeah, you can. You can oversleep. There is a point at which when we're sleeping too much, it actually makes it hard for us to kind of get going. And again, get those circadian rhythms going, and our cortisol levels, which are a hormone that needs to, you know, that gets us going in the morning. It needs to be elevated in the morning. And if we sleep, you know, 12, 14 hours, and we miss that opportunity for the cortisol, when the cortisol is high, we can actually end up staying sleepier and feeling lower energy throughout the day from too much sleep. So it's a good question. Could I tell you how much is too much sleep? I couldn't, because it really depends on that person's neurologic needs and what else is going on with them, and your age. You know, there are certain stages of life where we need more sleep or less sleep. But I think when we get into a place where we're above 9 or 10 hours, that usually doesn't serve well, unless you're sick, of course, and you need it.
Somebody said you've been napping.
No, napping, I'd say, is different. Napping is really wonderful, actually. That's different. I wouldn't like, there's a difference between getting 12 or 14 continuous hours of sleep and getting, you know, 7 or 8 hours and then taking a 1 hour midday nap, which has been throughout the world one of like the great patterns of human existence, is taking a nap in the afternoon, except for in, you know, countries on this side of the world. And what that provides is a chance for rest, relaxation, nervous system to calm down, get maybe another little opportunity for deep sleep, especially if we've had sleep debt, meaning like you didn't have a great sleep overnight and you're feeling like you're dragging all day. Sometimes getting that power nap in really does give you what you need to continue through the rest of the day. So that's a great, great question. And I get your question.
One thing and if that's a problem, is it a problem, or is turmeric more valuable to be used in supplements? Or how long does the patient have? 5 surgery?
Yeah, a lot of questions about turmeric, blood thinning, how long it takes to get through the body. Excellent questions, because there are people for whom turmeric is not a good choice to take as a supplement. I don't use turmeric for patients who have breast cancer. I don't use turmeric for patients who are on blood thinning medication, or who are going to be having surgery. You can eat turmeric. You can always eat turmeric. It's just those hyper concentrated doses that come from a supplement that we worry about. So this is where that individualization kind of comes in. So if a patient in front of me who's, going into surgery, or who's on Coumadin or has AFib or something like that, I will talk to them about ways to bring turmeric into the diet over taking a supplement. And if we were to supplement, it would be on the lower dose side versus some of the higher dose ones, because there's a wide range of them. Yes.
As far as your practice goes, should we schedule a consult with you to try to navigate the impact of our nutritional, what you were espousing here, and getting regular lab work and doing all the things that are part of the mainstream schedule? Is that the best thing to do? Set up something with me?
Yeah.
Okay.
Make an appointment. So I'm not a primary care doctor. None of us on the integrative team are primary care. The reason is because we spend so much time with patients. We spend 45 minutes to an hour with each patient. We deep dive into all of these things. So we always say, keep your primary care doctor. Obviously, you're going to need your physical exam, your colonoscopy order, your cholesterol panel, all of those things. And when you want to have these deeper dive conversations, we're available for you. And so a lot of people keep both doctors.
Yeah, it's about
Yeah.
Some going into an office with primary care physician can feel like you're part of a quota, and the time is not. There's a ration for your parents.
Yeah.
And that doesn't feel personal enough for us.
Yeah. Well, the American healthcare system is not built to do this.
Right.
So it's not really doctors who are determining how much time we have with patients. We've made concerted decisions in our integrative medicine program to work the way we work. That I will tell you is not, it's not sustainable in a healthcare system that's based on trying to get as many people in as possible. And that's through no fault of the physicians, I'll say that. Thank you. I'm going to take 2 more questions and we'll be.
What part of North Carolina, where do you appear in the roster of anything or make it pointing to be refuge?
It depends on your insurance. Usually you don't need a referral to see me. I'm in the roster. If you looked under Integrative Medicine and Endeavor, it'd come up there. We're all based in Glenview. Let me make sure I got everybody who, yes, Eileen.
Can too much sleep raise cortisol levels, which can raise BP, which could affect the brain?
Can too much sleep raise cortisol levels and raise your blood pressure, which can what?
Can too much sleep raise cortisol levels, which can raise blood pressure that can possibly affect the brain also?
No. It's a bigger conversation, but no. Yes. Last question. Yes, sir.
I lost most of my sight 3 years ago, probably as a result of radiation treatment. Are there ways? I don't expect to get my sight back, but are there ways to address some of that as far as taking care of myself through that or being aware of that?
I think the question is, these gentleman has lost his sight mostly from probably radiation treatment. And, are there other ways to kind of support your eyesight? Is that what I'm hearing?
To support my sight and to support the possibility of increasing radiation as a result of what radiation does.
I think if you focus on the things we discussed here, getting great sleep, social connection, despite the eyesight challenges, keeping yourself moving and connected, whatever eyesight you do have, trying to take in light and dark, these will continue to help your natural body rhythms to stay intact. And of course, a good diet, that really focuses on a lot of colorful veggies. So thank you all very much for your attention, your questions. We'll see you in a few weeks.
Doctor, if you put the slide back up, it has your name on it.
Yeah.
While you do that, I'll just talk a little bit, and thank you for joining us here today. A recording of this lecture will be available sometime this month. We also have recordings of previous lectures on our website. Please consider supporting the Levy Senior Center Foundation with a donation today. Your generous donations help us to continue to create opportunities to serve older adults in our community. The foundation table on the way out has a donation box if you wish to donate. You can also donate online at levyseniorcenterfoundation.org. And please, if you walked in late, there is a sign-in sheet at the table over there, so make sure you check your name off. And thank you again, and we hope you all have a wonderful rest of your day.
Thank you.
Thank you. Thank you all.